I am the Aftercare coordinator for the women over at the Rose.
And I'm the Aftercare coordinator for the men at the Star.
Our job entails planning the aftercare after a patient leaves us, whether that be sober living, IOPs, individual therapists, really anything that's going to continue the recovery process of the patient after they leave us.
Yeah, aftercare is not just important for patients coming out of treatment, it's vital. From the early stages at Lakeview, we're discussing with the patient that this is the baby steps. The therapist is talking about what's going to come next, what they're planning on doing, what's available to them, getting family involved, and then we see them 3 weeks before they leave to really set that foundation. Going home with no plan is not something that we do. We always have something in place for the patient, for them no matter where they're going, and if they need sober living, finding them that best resource, something that they can afford, something in the location that's desirable for them. We also, would place them in those outpatient programs like Lexie was talking about. But there's always a plan in place. Leaving here with no plan is just not an option.
Well, like Ben said, we start very early from when they get here, working with their primary therapists, working with their families, really everyone involved, letting them know that they have to really continue their recovery and the treatment process that we start here after they leave, so they can keep those things like their job, their family, their life that they have, because without recovery they're not going to have those things. One of the barriers you run into first is resources, whether that be money, location is a big thing. A lot of the times people might want to go home, but really it's not the best fit for them up there. And really just getting them to commit to a place and, to be willing to go to a sober living or, whatever is best suited for them to continue that recovery process after they leave.
When we see patients one-on-one, I like to come to them as a professional, somebody that understands what is available to them, somebody that can take their primary therapist recommendation for their aftercare and really put it into place. Say that I've seen these places, I've met the people that work there, and I understand what they are getting themselves into and provide them with the best option. Now, a lot of the times we'll hear that we don't understand, or how could you possibly think that I want to live in a house with 10 other guys, and at that point I may bring my own personal experience into it, that I have been there, that I've laid in those beds and sat through these groups, but mainly I want to come to them as a professional with the resources available to them, and 95% of the time we can just leave it at that.
When a patient takes what you say and they do it and they have faith in you and Lakeview is a process and have faith that we know it's best, and they follow through with that and they come back, 6 months to a year later, still sober, followed through with everything, that it's so rewarding to see a patient stay sober and listen to everyone here at Lakeview.
Yeah, there's a couple different things outside of helping plant that seed and watch it kind of flourish, and then being able to check back or see their progress along the way. It makes it all worth it. Also, seeing that super resistant patient, the guy that has nothing, that he absolutely wants nothing to do with any part of aftercare, and then a week later him knocking on your door and saying, let's do this. It's just, it makes it all worthwhile.